So I think for anyone trying to do innovation and improvement in health and social care today, there's two really big problems. One, it's no longer enough to engage with patients and the public more widely in a particular care setting, but actually we have to talk to them in their local community and how they experience their care across lots of different settings, whether it's at home, in a hospital, GP practice, or elsewhere. And two, we have to engage with people meaningfully. We don't just have to ask, what do you think about this particular issue, but we actually have to involve them in the understanding of the problem and the design of the solution. And I think Discovery can really help to address this problem for health and social care.
So no change works unless it involves the people who most either benefit or are affected by, or whose lives are changed by the change that you're trying to make. And by leveraging technology, we're able to contact 1,200 people instead of 120 or 12, which might be a more kind of typical number of people to be involved in a co-design process or a problem-solving process. So yeah, that's really it. It's that ability to really get the benefit of the insights and expertise of a really wide range of people, but also really quickly, which is the other thing that technology gives us.
Yeah, Discovery does address hearing everybody's voices, so it's really important to hear everybody's point of view, young, old, gender, diversity, cultural representation. So it's really good that everyone's voices are heard. The design of a piece of technology, a person's input in how that technology is when it gets home. How easy is it to use? How easy is it to attach? How easy is it to take a blood sample? That's the kind of commercialisation from the design part, if you had PPI involvement, to not just the research, but to the design and people's involvement. So that's really, really important, yeah.
Technology is going to be the thing that changes, or one of the things that change the healthcare system for the better. And we have some really practical interventions that are really going to make those things work. So I think definitely I see us using some of the same kind of templates of projects multiple times to influence different areas. So that's one thing. I think growing our crowd of participants, we already have more than 10,000. I'd like to see that 100,000 by the end of next year, 500,000 by the year after that. It's a fantastic thing to do, to participate in a Discovery project. It doesn't take very much time, it's not difficult, it's hopefully actually a bit interesting. Certainly is a really useful way of contributing to change in the NHS and in care as well, social care as well.
I've been in on the Discovery journey from the very start. It was a twinkle in my eye when I was writing the bid for this institute in 2017. And it's just been wonderful to watch how it's grown and flourished. It's gone from that very, very early concept through to something that I think is incredibly powerful and that offers a completely new asset to the NHS.